humerus. So that makes this muscle be an antagonist to itself. Yay, it's fighting in our upper chest area. So the breakdown of origin here, so how it's attaching to all of the cartilage within our ribs, so our sternum, and then over to our rib cage. We'll cover that more in chapter 4. But then it goes out below the head of the humerus to insert right here. But again, keep in mind that X, or that crossover that occurs between the upper and lower fibers. When we talk about actions here in a little bit, we're actually getting down to the lower part of getting through these muscles. But there is an all-fire action for all fibers of pectoralis major. So adducting the shoulder and medially rotating are when all three of these areas are firing together. And again, we'll talk about that more, those actions coming up. First, I just want you to keep in mind all of the areas of this pectoralis major muscle. I do want you to write down on the bottom, and we'll talk about this later, antagonist to the bicep brachii inflection. This is something that will help you once you're done with this book and you're out in the world working with people as a manual therapist. You're going to have people that talk about when they bend their elbow or straighten their elbow, they have pain here or there. But we want to remember the pectoralis major is fighting bicep brachii, and then that might help you kind of discern where this client is actually having this discomfort or pain that they're experiencing. On page 90 is a view that I'm just briefly going to point out that it looks like in this picture, like that the guy is sticking his hand all the way underneath there. But what I want you to notice is that the deltoid and the pectoralis major come together to form a lovely groove right about in this area. And you want to be able to define that or feel the difference between those two areas. As far as the pictures that are on page 91, they're just other ways to feel the difference or feel those different fibers of pectoralis major. More importantly is pectoralis minor. So, look at all, I just love all the coloring in here. So this muscle lies deep to pectoralis major, so minor is underneath. If we look at this picture that I have the highlights, we can imagine that pectoralis major is right on top of that. What I want you to notice about the origin and insertion here is that it is originating at the rib cage, the 3rd, 4th, and 5th ribs, so somewhere between the sternum and the axillary area, and then it inserts into the coracoid process, which the acromion is on top, coracoid process is underneath. So origin rib cage, insertion onto the anterior portion of the scapula, which is why I have here that the pectoralis minor elevates the rib cage for inhalation. So every time we take a breath, we're more stable on our rib cage, but this insertion, our scapula, has to be lifted, and so the insertion of pectoralis minor is trying to lift that up so that inside our lungs can expand a little bit more. But keep in mind, this is our upper thoracic area on the front. Pectoralis minor can be sensitive, so we want to palpate slowly and allowing your fingers to sink in. And before we even talk about a little bit of technique, I want you to also keep in mind that the brachial plexus, so the arteries, the nerves, those veins, are going out from the cervical vertebrae, below the clavicle, on top of the rib cage, underneath pectoralis minor here, and all the way down to innervate our arm. So this can be any area that can have that compression or impingement that can cause that sensation down. So we definitely want to focus in and remember that that's there. I do want you to know origin and insertion of pectoralis minor. Levator and pec minor, no. Origin and insertion for sure, as well as the actions, but we're getting to that here shortly. So this is another little thing that I wrote that might help you. Pectoralis major protects pectoralis minor. That might help you. Also, it is important to keep in mind that origin is rib cage, insertion is technically anterior scapula. So keep that in mind, okay? Here is a picture as far as techniques go, or how to feel the difference between pec major and pec minor. Easier to see in your book how pec minor is laying on top of this little three-pronged guy here, right? So we're seeing just how to do that. There is a way to separate pec major off of pec minor so that pec minor can work a little easier. And that's a technique that we'll do during class, but that's just how we can feel the difference between these two muscles. So there is a way to help manipulate those muscles so that we can reduce a little bit of tension in them. I promise we only have a couple more muscles left. I know this is a long one, this chapter especially. Page 94 for one quick drive-by muscle, subclavius, which if you just look at the name, you can tell sub is below, clavius, clavicle, it's below the clavicle. And it's a small secondary muscle. That's all you need to know. You don't need to know anything else about that one. So that one's super easy after the last couple. All right, page 95, bicep brachii. Bi means two, so we have two heads for bicep, the long head and the short head. So it lies superficially on the anterior arm. Keep in mind our anatomic position with our palm facing forward is always what we're describing here. So you can see the long head and the short head are coming up to the coracoid process and the supraglenoid tubercle. So it's technically above or upon the head of the humerus, so up near the top. And if you look here in your book, you can see that the humerus, the distal humerus is ending. So the insertion is actually down on our forearm. So origin, coracoid process, supraglenoid tubercle, but it attaches to the tuberosity of the radius, which is our thumb bone on this side, and the aponeurosa of the bicep brachii, which is down here, right below our elbow area. So origin up near the head of the humerus, or the very tippy top, and down actually to our forearm, which is why it is the primary muscle of forearm supination, because it goes up here and it comes down there. When we think that we're doing this, oh, look at my bicep thing, it's actually the muscle that's underneath that, which we'll get to in the next chapter, that's popping that up. So primary muscle of forearm supination is one of our actions here. You don't need to know the origin, although you do need to know it's at the head of the humerus and onto the scapula, but you don't need to memorize the exact spots. And you do need to know that it attaches on the thumb side, or this radius bone on our lower arm, just so you know that it goes the entire length of your humerus, even though we think about it just in that one spot where it's popping up. Down here, I have that the radius is the forearm bone, so below the antecubical space. I'm trying to throw that terminology at you as much as possible. It is also, bicep is deep to the deltoid, so if you can picture where your deltoid is, you can touch your deltoid on your arm and know that the bicep is underneath that. And then I want you to write down this, but right now, this is for later information. Pronation of the forearm lengthens the fibers of bicep brachii. Supination of the forearm shortens the fibers. Again, keeping in mind that this muscle is the primary muscle of forearm supination. So we're shortening the muscle when we turn our palm facing up or to hold a bowl of soup in our palm, that's the action of supination. Tricep is on page 97, so that opposite muscle. Tri means 3, so we have 3 areas of the tricep. So between these 2 pictures, we have the long head, which is attaching onto the lateral border of the scapula. The medial head is pictured a little bit easier here. It's below the head of the humerus, and it also goes down to attach to our forearm bone. Same forearm bone here. And then we have our lateral head, which is coming down below the head of the humerus, also to that same spot. So all 3 heads converge into one thick distal tendon proximal to the elbow. So back here, this is where tricep comes together. Tricep is the only muscle on the posterior arm. Again, keeping in mind, we have our anatomic position, right? And it is creating extension at the elbow and the shoulder. And even more, it's an antagonist at both of these joints to bicep. So when I bend my arm, bicep wants to do it. Tricep is fighting, that's antagonist. When I straighten my elbow, bicep says, no, I don't want to do that, but tricep says, yes, thank you, that's my movement. So the front of your arm is fighting the back of your arm in antagonistic movement. Tricep is fighting bicep. So again, keep in mind that, and I'll scoot the book down a little more so you can look at that black and white origin, scapula, below the head of the humerus, and also down towards the very distal end of the humerus, origin, 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 insertion. The very back of our pointy little elbow. You do not need to know exact origin and insertion of tricep, but you do need to know that it is attached to the scapula as well as the humerus. A little easier to see in this picture here, right? So it is attached to both bones, but then it inserts or attaches to that point of our elbow or right at the ulnar bone. And you're going to be so happy to hear this. This is the last muscle of the chapter. Whew! This is a big one. Page 99 for our coracobrachialis, also known as the armpit muscle. So just to look at it, and then I'll tell you a simple way to remember this, guys. So we have the coracoid process as our origin. So the second or the lower prominence forward, all the way down, and it inserts onto our humerus. So the easiest way that I can tell you for this guy is if you put your thumb about your coracoid process and then reach your finger down on your correct position of your humerus, that's about where your armpit muscle is. You will also know that when you strum it back and forth, it's kind of a sensitive area, so you're not going to be putting a whole lot of pressure. You don't need to know exact origin and insertion of this muscle, but you do need to know where it is located. So that's a good way to show that. Okay, so now we've gone through in this chapter the bones, the bony landmarks, the structures that are on top of the bones, and then we slowly added on all of the muscles of this chapter, which I know is a lot. If you turn to, just for an overview, and then I'll show it on here, we have pages 64, 65, and 66, which are all of the actions. If you will just humor yourself and go through these with how I have the stuff written on there, it will help you in the end. The most important thing is that you are able to know where the muscle is, which will tell you its action. And you'll see why that is now. All right, so we're going to start on the top of page, page 63. The top of page 63. First of all, I want to point out we're talking about the glenohumeral joint. which is also known as the shoulder, but you do need to know it as the glenohumeral joint. And we're going to focus on flexion for forward. So what this means is if I take my shoulder forward, I'm doing flexion. And I, 4 fingers, bring it forward. There it is, and all of the muscles are right here. Anterior deltoid. We have pectoralis major, bicep brachii, which is right here, and coracobrachialis are armpit muscles. 4 muscles bring my humerus forward, and they're all right here. A good way to see if you can feel all these is pretend you have a 100-pound weight in your fingers, and you've got to hold them there to identify these, and these muscles will pop out. So flexion is for forward. Extension is the opposite. Extension is 5, or we're bringing it back. So now I'm going to do 5, and I'm going to bring it back, or I'm going to use this arm so maybe you can see a little more. And all of the fibers are located on the back, or all of the muscles. Posterior deltoid right here, latissimus dorsi, which is right here, which does everything with its best friend, teres major. Pectoralis major, lower fibers. If I had a 100-pound weight and I'm bringing it back, I will absolutely be able to feel the costal fibers of pectoralis major moving. And then the last one is tricep, because tricep is back here. So deltoid posterior, tricep. On the front, we have the 2 best friends, latissimus dorsi and teres major, and then we have those lower fibers of pectoralis that are bringing my arm into back. 4 forward, 5 bring back. So I'm trying to make more sense out of it because it's not just about memorizing, it's about understanding. The bottom of 63, I have horizontal abduction is 1 away, horizontal adduction is 2 back. So this, notice, is only 1 muscle, but it's at the horizon. So if I bring my arm out to the horizon and I bring it back to you, it is only posterior deltoid that is making that happen, right back here. The opposite is horizontal adduction, so I go out to the horizon and I'm going to bring it forward, which is adding it to the center of my body. Anterior fibers of the deltoid, it's right here, right? If I'm at the horizon and I move my arm back, posterior deltoid. If I'm at the horizon and I come forward, it's anterior deltoid. But we also have upper fibers of pectoralis major. Put that 100-pound weight in your hand and bring your arm forward, and can you feel the upper clavicular fibers of pectoralis major that are engaging? So 1, to take it away from the horizon, 2, to bring it back or bring it towards the center of your body. A little easier to think of it this way. All right, top of page 64, still talking about the glenohumeral joint. We have 2 that do abduction. So to think of this, this is an all-fire action of deltoid. So I think of this as a can opener. The other muscle is supraspinatus. So supraspinatus is above the spine of the scapula, and then we have deltoid. I call this the can opener action. If I do this, it's like I'm opening a pop-top can opener, supraspinatus, deltoid. So lifting it up, all-fire deltoid, supraspinatus. The opposite, unfortunately, is adduction, and it takes 7, only 2 muscles to take my arm out, but look at, there's 7 of them to bring it back in. But this is where our best friends are going to come into play. We have 2 sets of best friends which are bringing it in. And if you look at the list, try to remember who your best friends are. Latissimus dorsi and teres major, because remember, they're getting us handcuffed, they got us in trouble. So that's the first set of best friends. The second set of best friends is the infraspinatus, and teres minor. So below the spine of the scapula and on that lateral border to my humerus, right? So we have 2 best friends, so now we've got 4 out of 7. The best way that I can tell you for this next one, so all fibers of pectoralis major, is, I know it's going to sound crazy, but if you had this happen, you would definitely do this. If I put a $100 bill in your armpit and I said, now you got to hold it there so that I can't pull that $100 bill out, you would feel all fibers of pectoralis major. So do it. Squeeze your humerus into your body, and I can't pull anything out of that. Can you not feel the clavicular, sternal, and costal fibers of pectoralis major all firing to hold that in? So now we're at 5 out of 7. When you're holding that $100 bill, could you feel your tricep engaged? So squeeze that humerus in, and can you feel your tricep? This one, the armpit muscle, it's really hard because we always want to forget about that guy. But I want you to think of trying to pull that $100 bill out from the front and the back. Coracobrachialis, or the armpit muscle, is here squeezing in, and then tricep is in the back squeezing it in. So if we think of our 2 sets of best friends, put that $100 bill in your armpit, you've got all of them. So 7 in for adduction. And not that it's getting crazier, but now it's going to get a little crazier. We have lateral rotation or external rotation, and I have 3 and DIT. I know it sounds super crazy at this point, but DIT is what we might think of if I just need to snap my fingers to the side. Just do it with me, and you will remember this for the test, and you'll never have to remember these actions. So DIT is when you snap your fingers, and when you do that, you're using posterior deltoid, infraspinatus, and teres minor. D, deltoid, and the 2 IT muscles, or these 2 best friends. So DIT, DIT, deltoid posterior, infraspinatus, and its best friend, teres minor. So 3 DIT to snap my fingers out to the side. It works. You'll never forget it, right? Because it's kind of crazy enough that you won't. One more movement for our glenohumeral joint. So we have medial or internal rotation, which is hand to your belly. So if you do 5, because it takes 5 muscles, and you bring your hand to your umbilicus or your belly area, it takes 5 muscles to do that. And in this picture, they're showing like they're attached to something, so I want you to put that 100-pound weight in your 5 hand and bring it to your abdomen, and you have to hold it there. Anterior fibers of your deltoid, so if you have that 100-pound weight, you can absolutely feel anterior deltoid. Latissimus dorsi always does something with his best friend, and so latissimus dorsi from your back, along with its best friend teres minor. Again, 100-pound weight, hold it to your belly. Can you not feel that on your back? Latissimus dorsi, which does, again, everything with its best friend. Subscapularis, if you have that 100-pound weight in your hand and you're holding it to your belly, can you feel your anterior surface of your scapula kind of struggling? It's hard. It's pictured here, but it's something that you need to feel. So put that 100-pound weight in at your belly, and you will feel that happening. And then an all-fire action. Look, pectoralis major. So our 500-pound weight at our abdomen, again, you would feel all of the fibers of pectoralis major firing. So 5 is hand to the belly, but you have to put some resistance into it. You have to put some weight into it to feel all of those. So those movements were actions of your humerus or your shoulder or your glenohumeral joint. Now we're going to switch gears, and I'm going to invite Mr. Skeleton back in because this is going to help us a little bit with this visual. Hoping you can see it. All right. So now we're talking about the scapulothoracic joint. So different. Now you got to let go of the humerus. Now we're only going to talk about what is going to move the scapula. So we have elevation of our scapula. I don't know, right? That's our action, elevation, where I'm going to take my scapula and lift it up. So if Mr. Skeleton was to do it, all we're doing is lifting it up. And if I was to take his scapula and lift it, I'm actually touching almost all of them. So upper fibers of trapezius, which are right here, pulling it up, right? Upper fibers. Rhomboid, major and minor. They're on that medial border, but remember, those are the I don't know muscles. So elevation of the scapula is I don't know. You got 2 out of 4. Rhomboid, major and minor. Trapezius, and then levator, because levator is an elevator, which means it's going up, it's lifting it up. So elevation, I don't know, and then just think of that elevator. Easy, right? Easy peasy. The opposite is depression of your scapula, which is 4 to take it up to I don't know, 3 to bring it down. So I want you to think of somebody pressing down on your scapula, and we're pulling it down. If we think of it moving down, would it not make sense that it's the lower fibers of trapezius? Upper fibers pulling it up, lower fibers pulling it down. Then we have serratus anterior with a fixed origin. So that means nothing else is happening and moving, and all we're doing is pulling this down. Serratus is underneath the scapula. So if you have 100-pound weight in each hand and it's dragging your scapulas down, it's going to be those lower fibers, but also you're going to feel it on that lateral border of the scapula. You're going to feel that on your lateral body, on your side body. And then the last one is maybe a little bit more challenging to think about, but pectoralis minor. Why would it be pectoralis minor? Because pectoralis minor attaches to the front of our scapula. So if I'm pulling my scapula down, would not these points at the front be moving too? So pectoralis minor. And if you had that 100-pound weight in each hand, and you're pulling that down, you're absolutely going to feel it right here. So always remember that resisted or contracted movement. Do it and see where you feel it. So 4 to make I don't know, 3 to bring it down or do elevation of our scapula. So as you can see, it can be a little easier if we just break it apart, and I think this is much easier than trying to individually memorize what each muscle does. So that's why I wait till the end. All right. These are going to get a little bit funnier. I'm going to move Mr. Skeleton over just a little bit. We don't need him as much right now. He's going to fall off his perch here. Still talking about the scapulothoracic joint, or the scapula. So I have adduction, which is also known as retraction, and I have 3 and show them. So I want you to think about when we, turn sideways there. I want you to think about how we typically walk in our natural habitat. Kind of hunched over, kind of like this, you know. We might have our computer, our phone in our hand, or a book. We're always looking down. So 3, to show them, is another way to say stand up straight and bring your shoulders back, which is adduction or retraction. I'm taking my scapulas and I'm retracting them together. So if these are my scapulas, I'm bringing them together. So rhomboid, major, and minor are on the medial border of our scapula. So when I say stand up straight, of course, I'm going to retract my scapula, and those rhomboid, major, and minor are going to be right there. So that's 2, and the other is trapezius middle fibers, because I'm taking my scapulas, I'm moving them together, and middle fibers of trapezius are laying right on top of it. So if you can just visualize, retraction is pulling them together. They're all right here. middle fibers of trapezius and rhomboid major and minor. Super easy. The opposite is abduction or protraction. So I have two written there, and I have yo-yo. I know it sounds kind of funny, but I saw this once when I was watching professional wrestling, and they walk out and they're like, yo, I'm so gonna beat you up, right? So that is protraction, abduction, or the yo-yo. And it takes two to make that happen. So when I'm doing that, I'm on my lateral rib cage. So if you think of that, like that yo-yo, my lateral rib cage for serratus anterior. And then the other is pectoralis minor. Pectoralis minor is right here, so it attaches to that point on the front of our shoulder down to our rib cage. So I want you to put 1,000-pound weight in each hand and do the yo-yo, bring your hands together. And can you feel that happening right here? So again, remember that resisted or contracted action. So protraction is to yo-yo, or I've had people go like, no, it's pro instead of yo-yo. That's fine. They were professional wrestlers that did that. So 2 for pro-yo, and 3 to stand up straight, or to show them how to stand up straight. The last one is possibly the hardest out of all of them. I'm going to move him over so that I want to use Mr. Skeleton as a little visual, and we're going to focus on upward rotation of the scapula. So we have our scapula here, and I want you only to focus on the inferior angle, so that lowest portion of the scapula, and we have to somehow take this inferior angle to the armpit. So it's an inferior action out to the axillary. So if I was able to do that, that is an upward rotation. So taking it up to the armpit, and trapezius, upper and lower fibers are going to work to make that happen, right? So the lower fibers are going to pull to the armpit. The upper fibers have to move also. And then we have serratus anterior because it's underneath my scapula. So inferior angle to the armpit, upper and lower fibers. And then because I'm moving to the armpit, that perhaps will help you remember that right below the armpit is serratus. So that's upward rotation of the scapula. The opposite action is downward rotation of the scapula. So now I'm going to take this inferior angle over to the spine. So upward is to the armpit, downward is to the spine. So again, I'm going to focus on this inferior angle, and if I'm taking it to the spine, our rhomboid major and minor are right here. So they are helping to make that happen because they're on that medial border and we're going to the spine. Levator scapula, because if, his head wasn't turned, so if I think of where levator is and I take this to the spine, can you imagine that levator has to do an action in order to move that superior angle away from the spine? Because that's what's going to happen for me to bring it here. And then the last one is pectoralis minor. So if you try to do inferior angle to your spine with a 100-pound weight, you will absolutely feel pectoralis minor in your upper thoracic making that happen. So I try to create with these actions a good visual with first identify how many muscles it takes to make it happen, and then put a weight in your hand or your arm or something to think of where am I feeling this. Which is why I tell you guys from the very beginning, the important thing is knowing where the muscle is located. Either it's on the front of my thoracic area, it's on my humerus, or it's on my scapula. all of these muscles are only going to move one of these bones, which goes back to our original joint complex or our shoulder complex. So when we think of the actions, I want you to remember that it's not as complicated if you know where the muscle is located.